So innovation, business, and research is the topic, and we have 4 panelists. Each one of them has, of course, a scientific background, but every single one of them is also active in some sort of business, and we will talk about that, and you will learn about their ongoing projects. I would like to encourage everybody to ask any question at any time. We have Marco over there with a microphone. He will fly to you, I think, and and you can interrupt us and ask your question, or also comment. You know, we are open to anything you would like to add. I would like to introduce our first panelist. That's to your right. It's Carlo Antonini. He has a PhD in technologies in energy and environment from the University of Bergamo. Is that the Italian way to say it? He did a postdoc at the ETH in Zurich and currently has a tenure track position at the University of Milano in your field. Fantastic.
Yeah, sort of. Yeah.
Fantastic. Good. He has a collaboration as a scientific advisor to a company that is called AP Tech. And in preparation, I looked, of course, at the website, and first I found out, oh, it's all in Italian. I didn't know what it is. Then I thought, well, AP, as a programmer, I know that, right? That's APs. Mm-hmm. But I learned, no, that's not it at all. API means something else in Italian. And Carlo, please tell us about AP Tech. Mm-hmm. What are you guys doing? How is there a transfer of knowledge from research into businesses? Enlighten us, please.
Okay. So I'll start with AP Tech first, or as we would pronounce in Italian, Apitech. So first of all, thank you for the opportunity to come here and speak today. I'm also an organizer, but I'm happy that I also was given the chance to come and speak about the opportunity I have as a researcher to collaborate with Apitech. So first of all, what Apitech is, so it's a combination of 2 words. I think tech everybody can understand in this audience. API is essentially an Italian acronym which stands for Association of Small and Medium Enterprises. And so there was an issue in one of the API, which is based in the area of Lecco, not so far from Milan. They realized that many small companies do not have the opportunity to promote innovation because either they lack an R&D department, so that's the case for 95% of the small medium enterprises, and also they do not have the people. So everybody talks about innovation, but to promote innovation you need to have people. So within this association they started to think about creating a service about promoting innovation. And to do that, they created Apitech, which I joined a couple of years back. And since then, we are trying to help small, medium enterprises and support innovation when they need to.
Okay. Can you say something maybe about the type of companies that you typically work with? I mean, you said it's small and medium, clear, but maybe the topics, like just the range,
yeah,
and maybe a bit slower.
Yes. Okay. Operating, we were born in the area of Lecco, as I said before, which is close to Milan. Most of the companies are operating with their hard manufacturing company, so really hard tech. No IT companies, no modern companies, and they work in the field of metal manufacturing. So they face different challenges. So either they have to make their product more efficient, or they have to make their logistic more efficient, or they have to go and look for new strategies. Because of course, with hard manufacturing, there is an issue in Europe, which is the labor cost, which is higher than the rest of the world. And if you want to be competitive, especially for small and medium enterprises, you need to have you need to sell a high added value product. Otherwise, you're just out of the market. And to do that, you have to continue to innovate. So there was a critical crisis a few years back, and also the area there was affected. But what I see now, so many companies closed. That's what happened. But on the other hand, many survived. And those who survived are fully aware that if they want to continue to survive and to do better and better, they have to sell good products, better products than the others. And to do that, they continuously need to innovate. And as I said before, either by doing better products or by delivering better services, or trying to find where the market is going and create new opportunities there.
Okay, thank you very much. The next person here on the panel to my left is Nehama Lewis. She has a PhD in health communication from the University of Pennsylvania in the USA. She did a postdoc at FIU in Florida. She's currently a tenured lecturer at Haifa University, but on sabbatical in Amsterdam. Is it the UvA or the VU?
University of Amsterdam.
The University of Amsterdam. And she is very international. She is from Australia.
Yes.
So, and you are, I've never heard that word, she is Chief Behavioral Officer at a company called Moderator.
Yes.
Are you serious? What is that?
They kind of made it up.
They made it up for you?
Yeah, we were talking about what exactly the title would be. I'm kind of at the core levels. They wanted there to be a C in the title, but what I do is strategy. But then they told me that in business, if I was called Chief Strategy Officer, that would mean something else that would confuse the investors. So we just decided on that.
Okay, so it's just a title.
Yes.
Okay, but tell us about Moderator. What are you doing there?
So when I started on the tenure track, I received very good advice, which was head down, get tenure. So that was the goal. And then during the work on the tenure track, I was approached by a nonprofit who do cancer prevention work in the area of colonoscopy. So they called me and they said that they had heard that, this is my area of expertise, getting people to do things that are good for their health by using persuasion. And so they asked if I would just give them input on a pro bono kind of case on their messaging. So I said, fine, because essentially that's what I do. And I think it's also good to do this kind of work, for the good of society. So I worked for them, and then they worked with Moderator, who are a small high-tech company. And then I met Moderator through them. And then Moderator came to me later and they said, we could use your expertise on a more regular basis. So I told them that because I'm in academia, my input would have to be limited. So it involves coordinating between the university, in a sense, and officially getting the okay to work somewhere else. So I did that. And so what I do is I work with them on strategy, and we solve business problems together. So I come in from the social science perspective, and there's a guy who's in charge of the algorithm back end, and there's another guy who's in charge of the health systems and the CEO, and then there's a particular client, let's say, with a population, and so we'll all sit together a couple of days a month, and we'll just talk through how we can all contribute from our various fields to update the platform in a way that's better.
Can you maybe, because it's probably not known to the audience, what is it that Moderator does? If I'm a customer, I don't know if it's for consumers or maybe it's for other businesses, but what are customers, what do they want? What is the product that Moderator actually...
So Moderator builds a platform that uses clinical data to create behavior change strategies and campaigns that then pretty much run themselves. But the back end is complicated. So I have a lot of input in terms of the persuasion strategies that are then matched to patients that have specific clinical data.
How should I imagine that? So am I a patient with a heart disease, let's say, or and then you try to get me to do more sports? Is that what I'm thinking?
No, for example, we had a client who was trying to get parents to have their children vaccinated with the HPV vaccine. So there are theories in persuasion that talk about getting to the population before they hear misinformation. And ironically, the theory is called Inoculation Theory. So what we did is we created a series of messages that ran on a time schedule through Facebook and WhatsApp. And we wanted to reach parents who were going to hear, oh, did you hear about this girl? You know, all this like anecdotal narrative stuff. And of course, they're free. Obviously, ethically, people should make their own mind. And, you know, we're not pushing, you know, people to do any specific thing, but we wanted to give them information. And then the client, in this case, wanted to increase vaccination levels.
Okay.
So,
can you disclose the client, or is that?
I can just say it's one of the health organizations in Israel.
Okay. Excellent. Thank you. So the next we have on the panel is Juana Flores-Candia. She has a very diverse scientific background, a PhD in biotech, actually here from Germany, is that correct? Yes. Did I read that? Postdoc at MIT and at the Helmholtz Center, which is also a German institution, right? But that was apparently not enough. You needed an MBA. That was also important. And you have multiple startups and patents all over the world, basically. Many different countries, many different continents. So you got into the business side at some point, and currently you work with GSK. And please tell us more about GSK as an Associate Director for Innovations Programs R&D. Please tell us, what is JSK and what are you doing, or what is your department doing there, and how does it fit into our topic here?
Absolutely. First of all,
thank
you for inviting me. A pleasure to be here with all of you. JSK, most probably you have heard, is the GlaxoSmithKline. It's the pharmaceutical company headquartered in London. They do have different divisions, like you just mentioned, the vaccines, HIV. They do have the pharmaceutical division, as well as the consumer healthcare, where I'm leading the innovation programs over there. What we are looking at is basically, our vision is to transform self-care. How we want to do this? We want to empower the patient to understand, to manage, and to anticipate a given disease. Not just a present one, but also maybe a potential one along the path. How we're doing this? I'm currently working on setting up a platform. We have heard of all these disruptive technologies, or those technologies that are changing rapidly the way we look at healthcare. We also heard before about devices. We're trying to integrate everything that's connected devices with data, every kind of data, environmental data, self-reported data, and using AI to process all and develop algorithms that are really personalized, that aim to be personalized. This is the integration of all, and the first platform we're building is for disease prevention, and obviously we have to start somewhere. And I work for the pain relief category, so we're starting with migraine. And so that's in short what we are up to right now.
Now, I'm not sure if I understood that correctly. The last sentence you said it's palliative?
No, migraine, headaches.
Yes. Okay.
Headaches.
Okay, good.
Yeah, pain management in general.
Okay. Can you? I mean, the topic that that we're talking about here is about research to business. Can you say something about that? Like, where do you use hot research in your everyday work at GSK?
Absolutely. Obviously, as a company that is very traditional and has been many years in the business, has a given set of processes and a given set of framework. And when you come into digital transformation, there is nothing that's been built in-house, correct? Maybe a little bit, but not the totality of the hard science. It's not coming from us directly. So that's where the open innovation, the external innovation is coming into play. And I have to say, it's been really rewarding to approach academia as well as the startups and middle-sized companies. We're partnering with them. So the projects we have right now, they are all in partnerships or working with different startups in different countries and assessing many of them, running due diligences and setting up the partnerships. And that's how we're operating right now, yes. And of course, trying to build the competence in-house as well, because it's not, we do need to learn how the mindset operates. We need to learn how the processes, how our own processes, maybe not the best ones we may use. You know, we try to get rid of that, which is not easy, and try to get the agility a startup has. A big corporation like ours is not agile anymore, correct? So how do you bring that mindset and that ways of operating of a startup or a disruptive technology group or university into a long-established enterprise? That's been a challenge, and it still is. As we'll continue to, yes.
Well, yeah, thank you for also your perspective here. I mean, that is important. We also wanted to hear that. And you mentioned the startup, and that's the next person here is Alex. He has a bachelor in computer science from the Belarusian State University, and apparently you were so obsessed, is that maybe the right word, with blockchain, that you founded various blockchain companies, or at least worked for various blockchain companies, and you're the founder and the CEO of a company that's called DEEP, D-I-E-P. It says a blockchain startup to help organizations to accelerate innovation. I can't wait to hear what that means. Please enlighten us. What are you doing? What does blockchain have to do with that, and how does it fit in innovation and all that?
So basically, we create an open network open research network, which actually helps connect like open innovation platforms from enterprises and academia. And our mission actually is to help scientists, researchers to deliver their scientific breakthrough to the society. And actually enterprises sometimes act as a gateway, and but incentive model of these collaborations is not always sufficient. So sometimes like scientist is afraid that their IP will be captured by these enterprises. Itself, like it's not necessarily a bad organization. It just the system itself is not efficient for that collaboration.
I'm sure many people here in the audience have heard of cryptocurrencies, the most famous, of course, being Bitcoin. And together with that word, a lot of people probably have also heard blockchain technology, which is the underlying technology of Bitcoin or cryptocurrencies. Now, you don't have your own currency, do you? That's not what you're doing, right?
No.
But you still do something with blockchain. Yeah. Can you maybe, for people who don't know anything about blockchain like the rest of us, like what is the main advantage that you see in blockchain for research and innovation here, right?
So blockchain is just a technology. It's a technology which allows to introduce common policies between individuals and organizations.
Okay.
And that common policy is governed by the protocol, not by centralized entity, but by the protocol. So programming code.
So it's decentralized.
It's decentralized.
That is a core part of your
It's
product.
actually like it's a technology for decentralized system. Decentralized system is not necessarily digital, but this is a technology to lay down your decentralized system on a digital infrastructure.
Okay.
And it might sound complex, but it's like the same way we treated internet like 20 years ago. I'm pretty sure like in 20 years, like blockchain will be, I'm pretty sure actually internet and blockchain will be kind of the same thing. So we will not distinguish this because it's kind of if you watch how computer science and like servers and like applications were evolving, so originally they were very centralized. So even user interface was on the same machine, and we were logging in on this machine to manipulate and logging in out. Then user interface started smoothly be separated from the server, and then we had an application server. And blockchain is basically everything, all infrastructure is completely decentralized, to have nothing centralized.
How does that help now for the collaboration, right? I mean, this is, we talk now a bit about the technology part, and that we have this decentralization, and most of the times you hear also safety, security, right? It's really safe, it cannot be broken, and so on and so forth. Tell us, like, how does it help the people that you're working with, that you're helping, institutions like also MCAA or other institutions? What's really that you bring to the table for them?
Yeah, so as one speaker from previous panel said, it's like it's really complex, I would say, technology. It's not easy to describe like everything in 5 minutes. But I will say that the most like powerful thing is ability to introduce new incentive models, for some collaboration, not necessarily between organizations, but between individuals and so on. And these incentive models can be very complex and will not need any supervisor to supervise the correct execution of these models. They will be supervised by algorithm, by consensus algorithm.
And the way I understand it, it is this contract or this algorithm, this protocol, as you call it, is agreed upon with everybody, right, in the network, and it cannot be changed just by one person or by one entity. And so the power is really to the network, to the community, and not to a governing body, as, I don't know, let's say in the research world, of course, publishers are a very strong player. They can kind of decide on which paper is published, so they can at least the protocol ensures that they are not stronger than anybody else. Is that?
Yes, something like this, and it just ensures that there is incentive model will be transparent, so you know that how it actually works. Because with a publisher, you don't even know like whether this journal was created because it's needed to be created, or some pharmaceutical company paid to create this journal and promote their own drugs. So
okay, that is a very nice example. Thank you. I would like to go back to Carlo, and I would like to make a round of tell us how did this all happen to you? That's all of a sudden you're working for or working with or for AP Tech. How did this came about? And maybe also from your experience that you had so far, give us one interesting example where you can where the audience can understand what you're doing and how this actually looks in real life.
Okay. So first question first, how did it happen? It was about 2015, 2016. I was still doing a postdoc or late postdoc as a scientist position. I was in Switzerland, where I went a few years back, thanks to Marie Curie. But then I had some offers to go on with academic institution, but they were overseas, and there were no way I could move my family. So at some point, I had to understand that my future was not in academia, because in Italy I knew I had no chances. So I stopped applying for academic position in 2016, it took more or less 1 year to elaborate the fact that I would not have an academic career. Within this time frame, I was looking around and tried to understand what I could do. I was working 80% at that time because I used one free day to go back and forth to my family over the weekend, because my family was based in Italy and I was in Switzerland. And so to make the long story short, I had this opportunity to start and using this free day, which I was using for my free time, to start doing some consulting with Apitech. And the idea was, okay, it's a startup. I'm not sure if it's a secure job, but at least I can, put my foot into the company and see if then I can.
Did you know
Also-
them, or did you apply there for Apitech, or how did that come?
I was looking online, and essentially I saw that there was this company looking every few weeks. I would see an advertisement for collaboration on scientific on R&D projects together with companies. And at some point, I applied for one of them, and I also saw that they were looking for essentially I think the correct name would be innovation manager. So I started to work with them, and the thing was going well. So in the meantime, I increased 2 days a week, so 40%, and the plan was to follow that. After more or less 1 year, the Italian government woke up and they realized I had sent an application 1.5 years before, and they told me, well, if you want, you can come back and have a tenure track position. At that time, the joke I make is that I had to look back to the grant to saw what I wrote, because after such a long time I forgot. It took another year to actually transition back. But in the meantime, I realized I had to really think what I should do, whether to stay in the academia or working with Apitech. And I found out that actually I could move back to Milan, and I could do both. This is what I'm trying to do now, and maybe in a few years I can tell you whether it works or not.
Okay. Can you give us an example, like a example that most people will understand?
Regarding the consulting we do.
Yes, right. How does that look?
Yeah. I can tell one of the most successful cases. One customers called us because they had an issue with an oven that they were delivering, because this company produces ovens for industrial applications. And of course, the problem had to be solved 3 weeks before, because they already had produced and delivered the oven, and the oven was not working as they expected. So we made a very short collaboration with them and tried to manage this very critical situation, because it was not only technical, it was really managing it with the customer to try to calm down and do the test to gain time. This was a spectacular Trojan horse for the company, in the sense that we could, they could test us, and with the time they gave us another contract, and at the moment we are collaborating steadily with them, and one of my colleagues work 40% of her time within the company. So she spent like 2 days a week working with this company, because they found out that we could give the technical support that they didn't have in the company, and they couldn't find somewhere else, apparently.
Okay. So this very much sounds like this company had a problem. They however, they came up to you, and they were convinced from what you delivered, basically, and they even hired people from your team.
Exactly.
Is that something that happens more often, or is that an exceptional case?
Okay. No, this is, I think, one of the way we try to collaborate with them. What I tell to some of the customers is, don't trust us, but put us on test. A small test. It doesn't have to be a large project. Also, because typically it's small, medium enterprises, so they won't go for hundreds of thousands of euros project. But typically, this is how it works. We actually start with a small project with them, and then some of them finishes there because the problem is solved, so there is no reason to go on. But in many cases, they just call us back, and this is the best feedback for us that, okay, we have done a good job last time.
Yes. And also people transitioning, at least part-time, from academia to the companies is also something you see more often.
Yes. So the typical project that we do with companies, and that we try to push the most is a scouting, technology scouting, with the idea of supporting the company, trying to solve a technological problem or trying to support them in a strategic decision. And we don't, as Apitech, we don't necessarily have the skills ourselves to solve it, but we collaborate with another company, which is called Find Your Doc, so Find Your Doctor. And they have a database of 2,000 PhDs who are based in Italy with very different backgrounds. It can be STEMs, so engineering, physics, chemistry, biology. Some of them are philosophers. Of course, STEM is more represented. But the idea is that when we define the problem, we help the company to identify a specific set of problem. We identify this, and then we identify the team that can solve the issue, which is a multidisciplinary team, because we think that complex problem need different perspective to be solved. And in some cases, we have seen that some of the researchers, maybe one of the team, either get an offer or continue with some kind of collaboration, although he still, he wants to stay in the academia. Yes, this is slowly, there is a slow transition into the industry.
Okay, thank you. Nehama, I was wondering if what Carlo was just telling us, is that something similar to your experience? Because the way I understood, also you first worked with some other company, and then you got introduced to Med Orion, and then you're working there.
I work with a non-profit who were working with them. And then we just sat in a meeting together.
Yeah.
And one of the guys in Med Orion was listening to like the social science perspective that, that was coming up at the meeting. And then he came back to me and he's like, we should talk. You should meet the other founders because maybe, we could use your input. So it kind of like started organically from there. But in that sense, I wasn't really looking for a consultation. It kind of just happened. And in a sense, also, I kept putting the brakes on because of my university obligations. And but what I find is it's very aligned with what I research anyway. So I can spend the time with the company, like testing questions that are things that I teach in class. Okay. And
can you give us an example? Let us in. How is it so directly transferable? Isn't that nice?
So I teach a class on persuasion, and there's a theory, one of the old theories, but I like it because it explains a lot. Cognitive dissonance theory. So we're sitting in a meeting, like I'll come into Tel Aviv and sit with the company, and they'll say that they have specific clinical variables, and then how can we use them to try and get people to do a specific behavior? So they don't necessarily know the psych theory behind it, but I'll explain to them that if somebody is, for example, performing 3 cancer prevention behaviors, but they're not doing like a colonoscopy, like a woman, for example, in the data set who's, say, 55, she gets her flu shots, she has, a pap smear and everything, but she just isn't doing the colonoscopy. So then what you can do is they can create algorithms that then segment that woman and other women who fit the same profile into a prevention-oriented but specifically dissonant group. And then the content itself can be matched to that. So you can send an email to that specific patient and say, it's great you're taking care of your health, but you might have forgotten something. And so what you do is you highlight the dissonance between what she's doing based on the data you have and what she isn't doing.
Okay, so you have a patient that it seems to be very health conscious, but there's one thing that this patient doesn't do, and you kind of tell the patient, say, hey, look, you're so healthy, but you missed this point. So and that is helping them?
Well, the logic is it's like micro-tailoring, but with big data sets. So we have like data sets of thousands of people, so you create personas that a lot of people will fit into. And then we do split testing. So we'll create like a specific message, and then we'll test it against a generic message. And in a sense, all the time they're testing, me as well, because I basically come in and I say, this
You
will
tell
work
them.
better. And then I come back after a month and they're like, yeah, usually it does, because
So
you get
you-
more opens and more click-throughs and that kind of thing.
Okay, so they tested you and
They're always testing.
well, they
me.
did.
Yeah.
They did make you chief behavioral officer. So you must have
Yes,
done something
yes.
right.
No, the combination works because I think I don't have an algorithm background.
No.
And I appreciate that expertise. I don't have it. They don't have a social science background.
Yeah.
And they appreciate my expertise,
Yeah.
but they don't. So I think there's a level of trust, like scientific trust there, and also a respect for what everybody can do. So we all have the same problem or the same client, and then we all trust that together we'll find some kind of a
Okay.
solution.
That very much sounds like what Carlo just said when he said we try to have interdisciplinary teams,
Yes,
right?
it's very much.
That is
I
what
like
you're
that.
saying.
Yeah.
Okay.
That's
Juana, is that something that you connect to? Interdisciplinary teams, having scientists come to GSK telling you what to do or what not to do?
Of course.
Okay. Tell us more, please.
Yeah, I mean, the programs are global, correct? So it's not just cross-functional, but also spread out across the globe. And that brings also a bit of challenges with the time zones. On the other hand, it brings higher productivity because then it's like you have the program running 24 hours 7, correct? So we do, big companies, they have the matrix organization, so definitely have cross-functional team leads. And also the second level of complication there is those team leads represents their functions, but they're not reporting to you directly. So you need to lead them by influencing, not by by the organizational hierarchy itself. We do have scientists from external divisions as well, which I love a lot, because we do recognize we don't have the right capabilities in the division. I try hard to get from other divisions, and I think the cross-pollination is even better.
Okay.
And
Can you elaborate on that? How do you find new collaborators? So let's say my background is in quantum chemistry, and I feel like I want to collaborate with you.
Nothing is secret nowadays, correct? We're in the era of data. I mean, you see everything,
Okay.
If you need...
So I just write you an email on LinkedIn?
Yes.
Yes?
I will know it.
And you will answer it, and you will look for that. Okay, I hope everybody in the audience took note.
All right.
No, I mean, seriously, right? Obviously, we are also interested in collaborations with large companies, and we would like to understand how is a good entrance in this.
All right, we do have our own search, internal search. We do look into, depending on the programs we're trying to set up. We work, for instance, if it is when we started digital, maybe I would give concrete examples.
Yes.
Okay,
Great.
that will depict better. When we started digital transformation program, obviously you have 3-4 pioneers on this, and you try. It's just driven by curiosity and trying to learn something new, and you get quite easily into that. But the point is, when you run into, then you have the strategy, of course, coming from the business school. Okay, strategy is not that difficult, but then you run into the next stage, which is execution. How I execute this, and how I bring such a different wave of technologies and design thinking and all that into this new company. This is new into this old company, let's put it this way. And so the first thing, we look outside for the key players. I mean, it's so easy nowadays to find who is specialize in blockchain, specialize in AI, specialize in disease control, specialize on different areas, pain management, all that. And then the next level is, okay, then we approach them, we try to work with, we look into startups, companies, we look into when we look into startup companies, obviously, given that we are in healthcare, we have to look the whole profile on clinical trials. We have to look what are the credits that the startup has in the healthcare. So that's one of the selection criteria, for instance. The other one, it could be that the technology itself is not that far away, that the clinical are not there yet, because we do know they take time. Then we look, okay, who are really who are leading this technology, who are really having the publications, the presentations. I mean, we're active on all those conferences all over. And then you start spotting them and trying to establish the relationship, approach them, and so on and so on. So that is relatively a normal process that open innovation, external innovation has, correct? So that's not nothing new. However, when coming back to execution, it's also about, is really the whole organization understanding it, is really ready to embrace it, is really ready to flex the processes we do have internally to make feasible that, to welcome that new technology and let them execute or implement. So that's where it comes also building competencies internally. And that's what we did with, we partnered with IMD, and we had like 150 employees having the training over a year or 2 years, depending on the functions and the level of responsibilities they had. So we have had that project as well. So it's working on both sides,
Okay.
especially in big corporations. I think that's important.
And that is now not only representative of GSK, but that is also representative of other big companies, or are you a unicorn in the big company world? Being so open and being so actively looking for outside
I
input.
cannot speak for many companies in general, but I think, I mean, the role, the impact, and the benefits academia and startups, companies, or pioneers on those technologies have is well recognized, correct? So, I mean, I think Open Innovation was coined in 2007. Some professor from Harvard, Shkor, started with. And I think that's well established in the companies. Let me mention one, just come to my mind. One of the big successes, and I admire that, is the one of Novartis. Mm-hmm. They launched the CAR-T therapy. And that was, they transformed completely how to manage disease and how to treat. And that was enabled by the work at the Penn State University. Uh-huh. And for me, it's really a great sample. So it is there. It's outside. I don't want to say we are the first. No, I think what I could say perhaps in the industry, on the digital platform, perhaps, but I don't want to say yes completely. Yeah.
Yeah, thank you for your insight here. Alex, I'm curious. How do the collaborations look like that you, well, I want to say facilitate, right? Because the way I understand your project is, it's more about facilitating a collaboration, an innovation process between a number of different agents, let's say that,
so
right?
We itself also a very deep science, deep tech company. One of my co-founder, he's a scientist, a mathematician. I have also a strong background in distributed systems architecture. So we run, for example, agent-based simulation of our models to predict some flows and eliminate them before launching for example, for new review models, peer review models. But in terms of how we facilitate collaboration between organizations and individuals, or small companies, so small R&Ds and so on. So there's multiple ways. So, for example, talking about open innovation platforms, you always can log in or actually can visit open innovation platform of GSK and see challenges which they currently want you to help them to work on. And so as a scientist, so you basically send a very valuable asset. You send your IP to GSK, and you want to be protected somehow. So one of our solutions, for example, is IP protection on a blockchain, which timestamps your invention, so you can always further prove before submission. And GSK can, for example, use it as well to protect all those who submit them in order to establish this trust. So they can always in future prove that that was our proposal, that was our invention. And it's just like, like there is a lot of big enterprises who are very honest, and they really want to help external innovators, but because there is no trust layer between them, it kind of hinders actually our progress, scientific progress. So, and this one of the model.
Okay.
Another model is
I think that is a very interesting point, really. And Juana, you were nodding, right? Is that something that you see sometimes in your collaboration, that a researcher might be hesitant to share something because they're afraid you steal it? Or they're just not trusting yet?
No. I in my experience, we never run into that situations because you have a clear management of agreement from the beginning.
Yes.
Starting from CBAs.
Okay.
So this is a different. This is when open innovation you go. I mean, there have been platforms already 10 years ago, correct?
Okay.
So it's something similar. No, when you go into partnership, first selection, and then you start talking with them. Because you want to protect both sides.
Sure, yeah.
And
that's what you want to do as well, Alex, right? Both sides.
Yeah.
a cheap way to do this, a cheap way to do this, maybe efficient.
Yeah. Okay. So, for example, without an NDA, a non-disclosure agreement, right? I don't need to sign a non-disclosure agreement. I don't need to talk to my lawyer.
Yeah,
it is all taken care of with the blockchain technology.
I think pretty sure that all the companies have this kind of all these non-disclosure agreements already, so in place. And you still even in that case, you're kind of protected. It just because system works in such ways that if you're a small individual, you always feel not that protected. So it's always good to have additional layer of protection, especially if it's decentralized and you know that nobody will be able to manipulate it.
Yes.
I think what he's doing is going one step further, correct? In my case, you have a target, and you know what you're looking for, and you start establishing the partnership for that specific target, correct? Now, he's talking about open innovation in broader sense, how you increase the productivity by having several applying several startups, because we cannot manage humanly, we cannot look in every individual.
You had one more thing that you wanted to share.
Not even more, but one more, multiple more. But
Okay.
So there's many opportunities, and for example, another thing is that you can establish a transparent review process. So you know that it will not be favoriting someone else when you submit, and the review process is implemented as smart contract. You know that it's going to be done exactly like it is and you can always check it. And another thing is tokenization of your invention as a how to say, kind of issuing shares specifically for invention without having a limited liability company or whatever. And for example, if GSK is helping somehow, they can agree very fast, just distribute these shares, these tokens, in one click, and half, whatever.
So I become a founder on only one idea, and I sell some shares of only that one idea, and I don't need to have a company or anything. It's all
and
taken
it
care
actually also works for enterprises itself. So enterprise also has some needs to innovate, and they also have internal R&D projects which they can also tokenize and, for example, fill the market by like fundraising and for these tokens, for example, for some external investors who might be interesting, so they can validate whether this invention is really interesting for the market.
Okay. Yeah. Thank you very much. We would like to open it to the audience. If you have any questions, any comments, anything you want to say or add. Yes, Anna, please.
Thank you. Thank you very much. I have one question for Alex and one for Nehama. So, Nehama, why do you, or how recently has the anti-vax movement become so strong? Because you're basically working for the other side, but they must have like a great persuasion. And the one for Alex is, what's your relationship with like the big publishing houses? Are they already scared of you?
So yeah, the anti-vax thing is huge at the moment. So the problem in general, first of all, ethics-wise, as a consultant, there are clients I won't work for, and like the line for me is very much aligned with public health evidence. So even with HPV, I mean, I did my homework and I looked, I wasn't 100% sure, but the evidence is that I felt comfortable. Like I can sleep at night knowing that I'm, trying to promote that behavior. But the anti-vax thing has been around and gaining strength as long as Facebook, so that's a while. And the issue is just the use of testimonials, which I think we're going to have really good workshops on that, storytelling. So what I do is I try and use storytelling on my team. So but it's really hard sometimes to give a good story about somebody who's been vaccinated and didn't get cervical cancer, because the time frame doesn't work and it's just not a very interesting story. But we use stories in other ways, so for other things. But yeah, it's a challenge. I agree. I don't know if I answered your question, but okay.
And for Alex, it was about the publisher houses, what they think of his idea, whether there's a lot of
they're scared.
pushback.
So
Yeah, whether there's
I'm
a lot
not
of
sure.
pushback.
I'm not sure. They didn't tell us, but I actually have been talking to some, I think, head of strategy of Chinese Springer. So I didn't tell them everything about our company because we also don't want to to let them be scared too early, But there are some organizations which are connected to Springer and which also, we saw pretty obvious signs that they're spying on us. So, but they exploring blockchain themselves. Yeah. So we just see that they not coming like anywhere with it. But I'm pretty sure some people are scared. But I know some people from like elsewhere who is supporting us. But they're working there, but they know that such profit margin actually not fair. So it's a profit margin which are not achievable by Apple, by Amazon and so on. So it's obviously they're exploiting the scientists, they're exploiting the whole industry to make this profit margin, and they have conflict of interest, and they have like a lot of leverage with the impact factor. They kind of controlling this industry. So in such initiative like ours, like Plan S, I'm pretty sure they're a bit scared about it. But I think. It's anyway we're gonna change.
Yeah. The writing on the wall is clear to everybody. We just don't know how it looks.
Yeah, and if they embrace new models, they might save their business. Yeah. I think. But if they do not embrace, I'm pretty sure like open science is gonna be like the major way how we do science. Like some people say that open science is actually the right science. It's the true science. It's science how it should be. Yeah. And for example, if you have read a manifest of internet, it was created for science, for distributing scientific papers and so on. Yeah. And for example, venture capital industry was created to bridge business and R&D. It just happens that they are more speculating right now. So it did well, but not completely. So we now want to fill other gaps.
please tell all the VCs and tell them to sponsor our event next year.
Yeah, so no, I've been talking to VCs a lot. So most VCs are not passionate about science at all, unfortunately. And it's a big, I think, how to say, miss opportunity for them, because most of innovation actually comes from science. But now venture capital industry, they don't want to invest in company if it's based on in own invention. It's funny, right? They want you to invest into a company which exploiting some other invention, which already proved to be successful, but by some reason they didn't find a way to deliver it to the market, and you just knew and convince them that you know how to deliver it. This is ideal case for venture capital. But if it's on your own invention, it's too risky. There are some venture capital who take these risks, and they are some major venture capital, but most of venture capital, they're just followers. So they follow others. So, yeah. But I think it's also, it's just, it's a system, how we deliver from idea to benefiting to product, to benefiting societies, and there's different tools for each step. And there is some good tools for, I think, the best tools right now in our society are actually for end of this process. So for distribution, there are a lot of venture capital, capitalism itself. It's a good thing for the end of this chain. But for the beginning, there are some outdated processes.
I can tell you also one very good program for the beginning of this change. It's called Marie Curie Fellow Actions, right?
Actually,
I think there's many people here who agree. We would like to take more questions from the audience, please. Yeah. Yes. Hello.
I actually have a follow-up question to Alex.
Yeah.
I would like to ask you how you envision the transition to using blockchain technology in science will take place. Did you already approach some research institutes or universities even, or are you? Will it be different worlds? You think?
Yeah. So I think in science, it's one of most interesting thing for me. It's actually introducing new metrics for science, which will avoid conflict of interest. But I think it's not going to be the first step, because it needs to be adopted by many organizations. But in science, there is already IP protection is something which scientists can already start using even right now, using blockchain. But I think it's still going to be a long process, and we play long term, and it's also not what venture capital likes. So, but it's going to be a long process. It's not going to be done in 2 years. It will take time. So, but I think some main gatekeepers for scientific industry who will start be using blockchain, it's actually grant givers in near time, and we already have some use cases for this. And I think enterprises will also come to use a blockchain. So it's actually adoption of a blockchain happens in enterprise segment. It's just not seen by everyone. Everyone pays attention to cryptocurrency, which is actually just only one use case of a blockchain, and which I believe is not going to give the first adoption of this technology, first widespread adoption of the technology.
Okay.
I hope I answered that question. Yeah.
Any more questions from the audience? Yes, please.
Yes, I also have a question about blockchain, and my question is,
Hot topic.
what is the best way forward to get involved in blockchain projects as a scientist? For example, there's a growing movement to investigate how blockchain technology and smart contracts can be applied in natural resource management. So I don't have a background in computer science, but let's say we want to manage water resources. I'm a hydrologist. So where's the role of scientists informing these projects, and what is the way forward? Would you say, okay, we all have to learn Ethereum coding, or how do we team up?
Yeah, you know, like you definitely don't know to learn, don't need to learn Ethereum coding, but you just, it sometimes it's helpful to understand the concept. It's like in order to apply internet, you had to the people who learned these technologies, they knew better how to apply this technology, like possible ways to apply technologies, but they didn't necessarily had a domain expertise where to apply it. And the same in a blockchain. So it was like originally for geeks, for tech people, and geeks and tech people sometimes don't know anything except tech. So and there is a big gap right now between technology, like people in the blockchain, and those who want to apply it to the business. I would suggest to try to find like a company who already doing in this field something, and try to find a company which tries to actually solves real problem and work with customer, with enterprises and so on. Because in blockchain there is like one I think very damaging trend that it continues to work on like enhancing technology itself, and this is because it originally was by for geeks. They don't want to deal with complex things like solving real problem. They actually raised billions of dollars for basic research, to be honest, on how to enhance technology itself. So just to find a company who is working in this field and connect to them and offer your help, I think they will appreciate it, and you can start working in that direction.
Any further questions from the audience? Okay,
I like to compliment on the blockchain.
Sure.
The question was, what are the applications in life science and in other industries? You know, there are already companies applying clinical trials because blockchain is about tracking and transparency and so on. I know there is some good results in clinical. The other example I have seen in Geneva is on the Swiss monetary funds. So they are using for the bills. And also there was another application I saw. They're getting rid of the notaries and the lawyers when it comes to validate the documentation, the serious documentations. And I think it's moving on. It's moving on. It's a very interesting development. What I could see, and I was talking to Alex as well, I think if we look more into pharma biotech, I could see also getting rid of all this unnecessary paperwork and GMP settings, for instance. So it's quite exciting area to look. Thank you.
Yes. Well.
May I follow up on this actually because this question also relates to the problem of having a transition in your career. Because of course, if you have a background in, you say, geology, right? And then all of a sudden you want to do something else, who's going to give you a job in something different, right? And the same was for me when I wanted to do something different. So I said before, and this is what I'm trying to do now, I try to work 80% on my core job, and that 20% I dedicate to something different. Of course, being in the academia gives this freedom, which not everybody has. This is one of the advantages working there. But I think it's helpful because it gives you the idea to try and collaborate on something different. And then see if it makes sense for you. Maybe also an opportunity to see if you like it, because, okay, it's a trend topic, you know, it's fascinating technology, but is it something for me or not? And you never know unless you actually put your hands on it. So if you try to combine this, I think it works well. And we all know by our PhD, right? Probably for many of us, we happen to have a weird experiment or a weird outcome that we did not expect and turned out to be a paper in the end, which is out of the main track of our PhD, but was something very successful anyway, and maybe promoting the next step of your career.
If we don't have any further questions, I would like to have a final question to the whole round. My final question is, how do you see the future? And yes, and maybe not as broad, of course, in our topic here of transfer knowledge from research into business. Anybody would like to say anything about that?
Okay, I can start. So I think actually that innovation and like scientists, researchers, like those people who create value will be more and more like rewarded, because now like value creation and value capturing is very different, and mostly people who capture the value benefit from that value, but with an automation and that like more and more like regular like manual work can be automated, more people will be involved into science, into innovation, and we actually as a society we become more and more innovation driven. So that I think it will lead to more efficient system to like reward those who create innovation, and actually more efficient system also to transition this innovation to some like commercial products, because now it's also not efficient. Some innovative like breakthrough can lay on shelf like for years, and it's not something like, and this is a problem. Like business also they want to recognize it, but they don't have enough expertise, and how to pick expert who will recognize it also needs two experts, so it's like recursive, you know. But I think these problems like already tackling, and they're gonna be solved, and we will lead to like much.
So you see that there will be a shift towards, or the researcher will be valued more than now, because you feel like there's maybe some people who are how do you say, piggybacking on that.
Yeah, no, not piggybacking. You know, it's also how to say value capturing is important as well, because otherwise it will be not adopted at all. Like it won't be commercialized at all. But I think that thing will
more
be
even distributed.
Yeah, more even. That's right. So reward will be more even distributed between all the chain which like delivered that innovation to society.
Very nice. Anybody else would like to comment? Or
Okay, Alex is giving me already. So it looks like.
As you please, as you please. It's the final round, and I know it's not the easiest question.
I wish I could have a ball, but I think what I can see is a massive transformation coming next. It's the amount of knowledge, data, technologies. We used to have a kind of flag phase and exponential and then stuff. But now it's all going exponential, exponential, exponential. So I think it's going to be exciting, but it worries me as well that we're not giving the right, perhaps, time to think about the ethical framework we need to put on those. We know right now about all developments in the robotics. We know about all the digitalization of all the industries. We used only 10 years ago or 15 years ago, we used to send the manufacturing sites to China. Now they're coming back. And when they're coming back, they're getting into all robotics. I mean, there is only one person operating the whole. And that poses also questions, how we are managing the job losses, how we are going to manage the transition. So that worries me a little bit, and I hope we will definitely think about that. And I think you all are in power because you have the science in your hands. And let's to think about how we make the best use of it without forgetting the ethical framework as well as our environment as well. There's another development on that front as well, how responsible and accountable we are for those developments. The other point, there is a lot of, how to say, ambition as well in the world right now. Let's to think about Calico, this company that Google set up, probably you may have heard. They're going against aging, correct? So it's very powerful, and they're really putting a lot of investment on that. I heard recently about transmutation. You know, we know what can be done in vitro. And that worries me a little bit as well. And if we look how the our science is evolving right now. Let's not forget China because they are dominating the digital, and we're talking about already G3 and coming G4 and so on. And they are going to be powerful on this. And given that their regulations are not the same as ours, so that worries me as well. So I don't want to bring too many worries. Yes,
Okay.
yes, I see with excitement the empowerment of patient people and the developments in science that will enable a better healthcare. That's the positive development. And the second one, I think we need to reflect and see how we can contribute to that ethical framework as well.
Okay, thank
That
you.
will summarize it.
Yes, thank you. Any more takers, or Nehama, no? Carlo, you would like to?
I can say something. Regarding us as scientists, if I think back, when I started my PhD in Italy, it was 2008. It was pretty much clear that a PhD meant you wanted to have an academic career. And also, if you wanted to go outside after that, it was really problematic. And that's why many of my colleagues and friends at university were thinking about like a more classical industrial career. However, it turned out that, as somebody mentioned before, this was not necessarily the easy way, because the world has changed a lot. And what I've seen now, even in small companies that do not have highly trained people, that do not have an R&D department, they are starting to, first of all, know what a PhD is. I have it on my business card, and in the last 2 years, nobody has asked me what does that mean. And it might be trivial, but actually, in a country like Italy, for example, it's not. A PhD is becoming more common, and also there are two beneficial things. So you start to see career opportunities, with specifically, a PhD title required, which might be more common in Northern Europe, but it was not in Southern Europe. And now it's making my life easier, because when I talk to companies and there is a PhD in the company, we speak the same language. And it's easier to build trust and to go directly straight to the point, because we share the same way of thought, in a way, even if we may have the different backgrounds. So I think it's good for us in the sense that there are opportunities for us which are getting more and more.
All right. Now, before closing and thanking everybody, I just want everybody to know how we proceed. We will have now 3 parallel sessions with short talks. There will be in the innovation room, which is over there, we will have 3 founders from the previous panel telling their story as a founder. I will tell a story about an innovator. About myself. Here in this room, we will have Maren. I think I saw her outside. She's a Marie Curie recipient currently here at the TU Berlin. She is investigating entrepreneurship of migrants. And after that, Anna is talking about careers in business. I forgot who else. There's 2 more. And in the curiosity room, there is more... Marco, you want to say something?
Yeah, I just wanted to say that the other 2 are Ben Hartwig, talking about science and improvisation in business. And there will be a presentation by Marion from CERN about the new cloud initiative,
yes, exactly,
where MCAA is participating.
And in Curiosity, we have EU funding opportunities, things like that. Is that right?
Yes, exactly.
Yeah, okay,
yes.
Good. For the organizers, we need some people to help get the chairs from here into the other rooms, just for everybody to know. And now I would really like to thank you all for being here on the panel and sharing your thoughts. Thank you all for listening. Thanks a lot.